This is Plant-Based Briefing. Acid reflux medicine may cause osteoporosis by Dr. Michael Greger at nutritionfacts.org. And I'm Marian Erickson, host of this plant-based podcast, where I curate a variety of articles on plant-based and vegan living and narrate them to you here with permission in about 10 minutes or less every weekday. And I'm pleased to have permission from Nutrition Facts to share their content. I was reading an article from Nutrition Studies. It was a success story from someone who had struggled with weight loss and found her way to a whole food plant-based diet and found success. And she talked about being on proton pump inhibitor drugs for 17 years and how she thinks those drugs made it more difficult for her to lose weight. And I couldn't remember what those were, and I know I'd referred to them in episodes before, but looked into it and found this article, which is pretty shocking. So take a listen, and now let's get to today's plant-based briefing. Acid reflux medicine may cause osteoporosis by Michael Greger, MD at nutritionfacts.org. Stomach acid blocking proton pump inhibitor drugs, or PPIs, with brand names like Prilosec, Prevacid, Nexium, Protonix, and AcipHex appear to significantly increase the risk of bone fractures. Nearly 1 in 5 adults in the world may have osteoporosis. That's hundreds of millions of people. The word osteoporosis literally means porous bone. Now, most of our bone is porous to begin with, but that's different than osteoporosis. Bone mineral density is considered to be the standard measure for the diagnosis of osteoporosis. Although the bone mineral density cutoff for an osteoporosis diagnosis is kind of arbitrary, using the standard definition, osteoporosis may affect about 1 in 10 women by age 60, 2 in 10 by age 70, 4 in 10 by age 80, and 6 or 7 out of 10 by age 90. Osteoporosis is typically thought of as a disease in women, but 1/3 of hip fractures occur in men. The lifetime risk for osteoporotic fractures for 50-year-old white women and men are 40% and 13% respectively. The good news is that osteoporosis need not occur. Based on a study of the largest twin registry in the world, less than 30% of osteoporotic fracture risk is heritable, leading the researchers to conclude prevention of fractures, even in the oldest elderly, should focus on lifestyle interventions. This is consistent with the enormous variation in hip fracture rates around the world, with the incidence of hip fracture varying 10-fold or even 100-fold between countries, suggesting that excessive bone loss is not just an inevitable consequence of aging. The U.S. Preventative Services Task Force, an independent scientific panel that sets evidence-based clinical prevention guidelines, recommends osteoporosis screening, such as a DXA bone mineral density scan, for all women aged 65 years and older, and potentially starting even earlier than 65 for women at increased risk, such as having a parental history of hip fracture, being a smoker or an excessive alcohol consumer, or having low body weight. What should you do if you're diagnosed? Or more importantly, what should you do to never be diagnosed? Before exploring the drugs on offering to treat osteoporosis, there are some drugs that may cause it. So let's start there. Stomach acid blocking proton pump inhibitor drugs, so-called PPIs, with brand names like Prilosec, Prevacid, Nexium, Protonix, and AcipHex, are among the most popular drugs in the world, raking in billions of dollars a year. But then in 2006, 2 observational studies out of Europe suggested an association between intake of this class of drugs and increased risk of hip fracture. And by 2010, the growing evidence forced the U.S. Food and Drug Administration to issue a safety alert implicating PPI use with fractures of the hip, wrist, and spine. By now, there have been dozens of such studies involving more than 2 million people who, overall, show higher hip fracture rates among both long and short-term users at all dose levels. The irony is that most people taking these drugs shouldn't even be on them in the first place. These PPIs are only FDA approved for 10 days of use for the treatment of H. pylori, up to 2 weeks for heartburn, up to 8 weeks for acid reflux disease, and for 2 to 6 months for ulcers. Yet in a community survey, most users remained on these drugs for more than a year, and more than 60% of patients were taking them for inappropriate reasons, often wrongly prescribed for indigestion, for instance. Calls to stop this massive overuse from regulatory authorities have fallen on deaf doctor ears, and now that they're available over the counter, the problem of overuse may have gotten even worse. They can be hard to stop taking since many patients experience withdrawal symptoms that can last for weeks. In fact, if you take normal, healthy volunteers without any symptoms and put them on these drugs for 2 months, and then covertly switch them to a placebo without their knowledge, all of a sudden they can develop acid-related symptoms such as heartburn or acid regurgitation, so ending up worse off than they were before they even started taking the drugs. In addition to bone fractures, this class of drugs has also been linked to increased risk of other possible long-term adverse effects, such as pneumonia, intestinal infections, kidney failure, stomach cancer, and cardiovascular disease. In fact, the blood vessel effect could explain the case report titled Abrupt Onset Profound Erectile Dysfunction in a Healthy Young Man After Initiating Over-the-Counter Prilosec. Oh, and also premature death. There are individuals with conditions like Zollinger-Ellison syndrome, stricken with tumors that can cause excess stomach acid secretion, for whom the risk versus benefit of long-term use may be acceptable. But that's a far cry from the 100 million PPIs prescribed annually in the United States alone. To deal with acid reflux without drugs, recommendations include weight loss, smoking cessation, avoiding fatty meals, especially within 2 hours of bedtime, increased fiber consumption, and overall, a more plant-based diet, because non-veganism is associated with twice the odds of acid reflux-induced inflammation. Other classes of drugs that have been associated with hip fracture risk include antidepressants, anti-Parkinson's drugs, antipsychotics, anti-anxiety drugs, oral corticosteroids, and the other major class of heartburn drugs, the H2 blockers, such as Pepcid, Zantac, Tagamet, and Axid. You just listened to Acid Reflux Medicine May Cause Osteoporosis by Dr. Michael Greger, MD at nutritionfacts.org. And I'm your host, Marian Erickson. I've done a number of other episodes about osteoporosis and about acid reflux. If you'd like to check those out, just put those terms into the search field wherever you listen and those will pop up. And I'll add some into the show notes as well. So please share this episode with anyone who might benefit, and thanks for listening.